Did you know one rush blood pressure could lead to you taking medication for a long time and you may not even need it? And worse yet, what if you had a false low blood pressure reading and you're missing a major warning sign? I'm Dr. Rose Petrilla, the Primal Professor, and in this video, I'm going to teach you how to take a blood pressure the right way. I'm also going to expose the common mistakes that are made in doctor's offices, and then stick around to the end because I'm going to teach you how to advocate for yourself in a polite way. Because your numbers matter. Let's get started. Let's be clear. Your blood pressure reading isn't just a number. It's a decision maker. It's going to determine whether you're classified as hypertensive, prehypertensive, or normal. And this could have impact on your life insurance policy, whether you qualify one or not. It can determine whether you're put on some medication for a lifetime. And yet, even though it's that important, so oftentimes it's rushed through. It's done inconsistently, hastily, even incorrectly. One bad reading can change the course of your care and your health. I'm going to tell two stories. One, I want to give credit where credit is due. I recently went for a doctor's appointment, and I knew they were going to be checking my blood pressure and whether I was going to go off some of my medicines. And I honestly it was the best blood pressure in my almost 60 years that was ever taken. It was textbook. And it was a young woman. I don't know if she was a med tech or a nurse or what her classification was, but I told her that was the best blood pressure I've ever had taken, and I know it's the most accurate. And she was beaming because so oftentimes in the healthcare profession, we're so busy, we're stressed, and we forget why they held us to these really strict standards when we went through school. And as a professor and the program coordinator of a program at Penn State for physical therapist assistants, I held those students to those standards. And so I recognized what a beautiful job she did. And I said, don't ever change. You're doing it right. And so many other people aren't. And she was beaming. It was a great moment. And I really wanted to praise her. So she continued to take that much care as she did with me. And as a result, that blood pressure was enough for me to finally, after being hypertensive for almost 20 years, to get off blood pressure. It took 5 years of keto, and I was coming down, and I finally got rid of the medicine. But I'm going to tell you another really important, where the stakes were a little bit higher. For one of my students, she was an adult learner. She was in her mid-20s, 26, 27. In the world of academia, that's an adult learner. And she had type 1 diabetes from a child. And she taught me something very important that I never had heard of before. Oftentimes, when you have type 1 diabetes and you get it in childhood, you are insulin dependent. You have to take insulin. And insulin's the hunger hormone. It also tells your body to store fat. And so as a young teenage girl, she struggled with her weight. And she figured out on her own that if she would lower her insulin, she could lose weight. And unfortunately, for the next, 10 years or so, or 5 to 10 years, she lowered her insulin and kept her in, so therefore her blood sugars ran high. And so now she was starting to get some of the chronic conditions associated with diabetes. And she was sitting in a specialty doctor's office, a kidney doctor. She was starting to show signs of damage to her kidneys. And after just learning to take her blood pressure while in class, she was taking it frequently, and she knew it was going up. So she had to see the cardiologist and the nephrologist. So when they took her blood pressure, I don't know if it was a nurse or a med tech, and this person's looking at my student who's a young woman, and she goes, 120/70, and my student said, no, it's not, because she knew it was high. She goes, will you take it again? And it was such a proud moment for me as a professor teaching my student who was going to go on and have that same, she knew how important it was to her own life to get that measurement right, because the kidney doctor was going to make decisions based on that number. And when the woman took it again, she got the real number, which was nowhere near 120/70. So if my patient hadn't advocated for herself, the trajectory of her care would have gone in a different direction. And so I just want you to remember that it's, as when we talk about advocating for ourselves at the end of this video, it's your responsibility to do that. You need to speak up for yourself, and we'll talk about the best way to do that. Let's talk about the common mistakes that occur in doctor's offices. So take a look at this picture. I'll give you a second. There's a lot going on here, and there's a lot of mistakes happening here. He's not resting before his blood pressure. Obviously, he's jumping up on that table. He's talking on the phone, and even a casual chat while the reading's occurring can put a blood pressure up by 10 points, specifically the systolic or the top number. His legs are crossed, and that raises both the top number and the bottom number, the systolic and the diastolic. The arm is not at heart level, so that can give you a false high or low reading. And his feet are unsupported, and the back is unsupported, so that makes autonomic nervous system changes, which could change the blood pressure. And the cuff over the sleeve also can result in it can alter the result of the reading. There's also improper technique that can occur by the technician. So, as I said, I had a great experience this last about 2 weeks ago, but my student, it's not that person, what really makes me mad about my student situation was it wasn't that the person didn't know how to take the blood pressure, but she didn't care enough to do it right the first time, and she judged her because she was a young person and assumed that she was going to have a low blood pressure. All right, so, and sometimes the technician doesn't pick the right size cuff, or they don't tighten it snugly enough, or they don't position it over the brachial artery. Now, if you look at this picture, this clearly is the wrong cuff size. It's too small, which will give you an artificially high blood pressure reading. Only another mistake that's made is oftentimes they only take it once. Really, you should take it a minimum of 2 times, about a minute apart, and then average them. But even up to 3 times is better. And if you came in and you were rushing to your appointment, you need to let the clinician know that. But if you're rushing and it's super, super high when you first go in, oftentimes the doctor's office will then retake it after you've been sitting there for a while. And if you think, no one really considers the time of day. So if your appointment's first thing in the morning and you had coffee and just had a cigarette, then your blood pressure is going to be high. White coat syndrome is a real thing. My son has it whenever you take his blood pressure, and even as a young child, he had it. And I'm like, do I have to give this kid medicine? And one time he fractured his thumb and he needed to get a pin in it, so he was getting knocked out. I'm like, could you please just take a blood pressure when he's under so I can know that he's not abnormally high, which his blood pressure was fine. He was very healthy. And then finally, who knew this, but a full bladder can actually put your blood pressure up 10 to 15 points. And so often these blood pressures, when we're running in the doctor's office, it's like, you're in, you take your weight, your height, they're sitting you down, they take your blood pressure, and boom, boom, boom. So oftentimes it's in a rushed environment. So at the end, make sure you go to the description, and I'll put a link to this. It's a free checklist. You don't have to give me any information. You can go to the link in the description and print it out as many times as you like, or give it to someone that maybe has to take who has to monitor their blood pressure. And if you start getting some abnormal readings, I recommend highly that you get a home unit. And I recommend not to get the wrist unit, but as we saw in those previous pictures, ones with the cuff up near the arm. And if you have a big arm, make sure you get a larger cuff, because that can give you an abnormal reading. Now, here's the checklist. Before the reading, you need to sit quietly for 5 minutes before measuring. You want to avoid caffeine, smoking, or exercise within 30 minutes of taking the reading. And you want to empty your bladder before you take a reading, okay? Then once you've rested, you want to make sure you're in the right body position. You want to sit upright with your back against support. You want your both feet flat on the floor, legs uncrossed. You want to rest your arm at the level of your heart, so you can get a pillow, something to prop your arm up high enough so it's even with your heart. And then during the reading, you want to expose the arm, and if you pull your sleeve up and it's really tight, then put a gown on, or if you're at home, just take your arm out of the sleeve, and don't place the cuff over. I don't care how thin your clothing is, don't place the cuff over any clothing. Use the correct size cuff for the size arm you have, and do not talk or move while the reading is occurring. So usually if you have one of the home units, you're pressing the button and it's going to inflate the cuff, and then while the cuff deflates, I don't want you to talk that whole time or move. And then take at least 2 readings. 3 is better, a minute apart, and then you'll take the average, and that would be the most accurate way to do it. So on this page, you'll see I just made a form. Again, if you're starting to have symptoms of hypertension, and I think it's really good to get a cuff to monitor, especially if you and your doctor are working together to get the right medicine. And here on this channel, we promote a low-carb lifestyle, particularly a ketogenic diet or lifestyle, but really it depends on where you're at, what level on the low carb spectrum you need to be. But if you have hypertension, you probably already have the beginning of prediabetes and insulin resistance. That's probably the biggest cause of primary hypertension, meaning it's not really caused by something else. It's just you have a lot of inflammation going on in your body. And I did a video a couple weeks ago. I'm going to post it at the end of this video, and that's where I go into all the pathophysiology of how what with high blood pressure, and the root cause is often insulin resistance and prediabetes, and how the ketogenic and low carb lifestyle can help lower your blood pressure, or eventually, like I did, reverse it. So on this sheet, and again, I'll put the link for this sheet in the description as well, and you can print these out as much as you want, but it gives you a blood pressure log for the week where you can measure it twice a day. And if you did this, if you had an upcoming appointment and you had white coat syndrome when you get in the doctor's office, or you get nervous, taking a blood pressure log like this in at home can really help your doctor make the best decisions regarding medication for you, because it's not a one-time snapshot of your blood pressure. So feel free as often as you like to print this out as well. And the link is in the description again. So finally, I want you to feel comfortable advocating for yourself. If you're in the clinic and you notice that someone's not taking your blood pressure correctly, I don't care if it's low or high, because they both have implications. You can say something respectfully, and you should say something. It's your body, your health. You need to say it. And so how could you say that and feel like you're not offending someone? Well, you could say, would you mind if I roll up my sleeve? I heard that helps take a more accurate reading, or it helps with accuracy. And that person's not going to deny that because they know they should be doing that. Or you could say, can we have a minute? I just walked in. And maybe you were in rush hour, maybe you left work late and you were trying to get there. That's absolutely fair. And then this other thing you can say is, can we take it a second time? Because you could then say, at home, these are my readings. And it's oftentimes, if there's a big discrepancy between your readings and the doctor's, I would next time take your blood pressure unit in and they can double check its accuracy. Okay, so, but could we take a second reading just to be sure? Because going on medication has implications, and let me just say, going on medication has implications. Now, don't mistake me for saying don't go on medication, because I want to be clear. If you have hypertension, you need to treat it, because it's the silent killer. That's its nickname for a reason. You really don't have a lot of symptoms, but it's doing damage. It creates more pressure throughout your body, and that causes damage to your body. So again, I'm going to urge you to watch that video. So if this video helped you feel more confident in taking your own blood pressure, or more confident in asking for an accurate blood pressure at the doctor's office, then hit the like button and subscribe. And don't forget, in the description, you can get a copy of how to take a proper blood pressure, and also the checklist, and also the log. Thank you for being here. I appreciate you. I'll see you in the next video.